Okay, thanks Preeti for your kind words, and thanks so much. We'll be taking two presentations, one after the other. And the first one will be a combination rejuvenation strategy. And later we'll be talking about how dermatologists and plastic surgeons and all of us need to work together to make our results appear better. Thank you to all the faculty who've been patiently tolerating me and this instruction course for the 4th year in a row. I think it's amazing and it's a privilege to be teaching you all for the 4th year in a row. Of course, this year we are not there in person. My name is Dr.Debraj, and we run a chain of clinics called the Aesthetic Clinics, which is now in 6 cities in India. And there are some financial disclosures in place. I'm a faculty with Allergan for the past 15 years for the Asia Pacific region, a faculty with MERS, which makes Xeomin and all other products, and a faculty with Aptos, which has just entered India and deals with all the cork threads that we will be using in this particular presentation. We understand that beauty is something which is very important in today's day and age. I believe that when we operate or we treat the face, we are actually going ahead and treating the brain. Everything related to confidence is related to your face, and how you look is how you're perceived. And therefore, it becomes very important to take care of this. On a young woman, especially when we look at them at 45 degrees, we see that there is a S-shaped curve called the OG curve. And generally what aging means is that the entire face is moving downwards and medially with age. That's very critical to understand, because unless and until you understand what is aging, how will you really define strategies for anti-aging? And as the hormonal changes occur in women, especially as they become perimenopausal and start approaching menopause, and in men who are above a certain age, essentially the reduction in the testosterone and the estrogen and the progesterone leads to the fat pockets of the face changing. So generally in younger people, there's more superficial fat than deeper fat. And the superficial fat gives us the look of a grape. As we age, the deeper fat becomes more. So as a result of which we start looking like raisins. So when you think about the grape to raisin analogy, you know how aging occurs. And that's why volumization is becoming more and more important, because deflation is playing such a key role in aging. Now, also with this, there's also aging of the other things. The SMAS is aging, the elastin tissues are going downwards, folds are developing. There are various other changes which are occurring. Also, the skeleton is changing. So essentially, the bones are becoming smaller as we age as well. And the facial skeleton is also rotating. This is a great paper by Lambros. And if you have not read it, then I request you to read it, because it will sort of tell you and amplify some of the changes and elucidate better some of the changes which are occurring on the human face. So in general, what's occurring as a part of aging is that the bed is becoming smaller and the bed sheet is becoming more and more. And as the bed sheet increases, the redraping of the bed sheet means that there is an excess of tissue in certain parts. The excess is not that much as the bed becoming smaller. So that's basically what we need to think about. And therefore we use implants, we use fillers with the idea to sort of remodulate the bed, which is the bony structure. Now, it is a little strange, and I spoke about this in my earlier presentation a couple of days ago as well. I always found it a little strange that we didn't understand how Indian faces age. And obviously, when you look at Indian features, we are very different from East Asians, we are very different from Latinos, we are very different from the Caucasian race. So then I always wanted to understand why we did not have enough data on Indian aging. And that's what we call the first aging study from India, using sequential photographs, where we studied 300 participants over the age of 30. And we sort of figured out how people aged over a period of time. So you took sequential photographs and followed them longitudinally. And you found that over a period of time, you could understand and detect patterns of how people were aging. Look at this lady at 23, look at her at 37, look at her at 71, and as she goes to 86. And you see how everything seems to be sagging downwards under the impact of gravity. You see very clearly how the under eye hollows are developing. You also see very clearly how the nasolabial folds and the cervicomental angle is becoming worse as she ages. Similar woman, another lady at 20, 34, and 45. and you see how aging sort of progresses. And as you look at more and more of these pictures, you start developing patterns. Patterns are important, like in disease recognition. Similarly, in age recognition also, patterns are important, because if you can't recognize patterns of aging and you can't understand how people are aging, then how will you prescribe anti-aging techniques? So in general, I request you to read that particular paper. But essentially, the tenets of the paper are as follows, which is the upper third of the face ages very well in Indians, possibly because of the fact that we have a thicker dermis, possibly also because of the fact because melanin in our skins is protective against aging. It's mainly the mid face, the lower face, and the necks which are a problem area. And the buccal fat pads are reasonably well maintained. Now, this is important because obviously, if our mandible or jaw is thinner or is smaller than the Caucasians, but yet the amount of fat that we are putting on over a period of time or the soft tissue is increasing, then we can't have the same techniques which trainers from the US come in and teach us, which is basically pump the face with fillers. In fact, what we are seeing more and more is what we call the overfilled syndrome, because obviously Indian faces are not necessary to be pumped with fillers the way Caucasian faces are. Now, as aging progresses, we know that there are nasolabial folds, and these nasolabial folds can be graded. And this is a wonderful paper by Lamperl, which I request all of you to read, so you can sort of decide how the aging occurs with regards to the midface and the nasolabial folds. Now, if we look at some of our patients, you look at this particular lady. This particular lady came into us, and she had been to a couple of very, very renowned plastic and oculoplastic surgeons. The idea was that she wanted to get treated. She felt that she had squint in the right eye, but clearly you can see the light reflexes in the center of the cornea. And if the light reflexes in the center of the cornea, what's going on? What's going on is that the right brow is higher than the left brow. You can see that there is an inferior scleral show on the right side, which is more than the left side. And clearly there's some form of orbital dystopia because both eyes don't look the same. And when she smiles, this difference between the two eyes gets more amplified. You can see that the left eye becomes even smaller because of the hypertrophic orbicularis oculi role. And you can sort of begin to understand why she must be so distressed. Now, in a patient like this, performing ptosis surgery or performing any other surgery is not something that can be done predictably enough. Therefore, we treated her with Botox 2 units to treat for the hypertrophic orbicularis oculi and a little bit of filler, and sort of transformed her from here to here to showcase that both the eyes now become similar and there is no real problem which is there. And this patient has been on follow-ups over a decade now. And you can see how by treating her once a year, we are sort of giving her the results and without any risk. See, it's important. See, different strokes for different folks. The point is that people come into aesthetic surgeons when they want to look better. And if you want to make people look better, the risk that we are willing to take on such people should always be a 0% or as close to a 0% as possible. And therefore, it's important to titrate our treatments in that manner. Similarly, another lady, she came in maybe initially about 15 years ago, and she's been on follow-up since then. Today in her 60s, she actually looks better than she did in her mid-40s. And the difference is how incremental changes on the face can make people look better. If people stick to the right surgeons, you can actually have them aging better in their 60s than they did even in their 40s. And this particular lady, when she smiles, you can see why she feels people think she's angry or she's irritated, because lines on the face create perceptions. Lines on the face will get you evaluated on how much energy you have, how happy you are, how sad you are, how important you are, whatever. I mean, it's all dependent on the way your face ends up looking in some ways, right? Because people can't see your heart in the first 7 seconds, unfortunately. So it's going to be a face which is going to rule the roost. And therefore, using Botox in a particular manner, using the fillers which are necessary, using Botox again in dynamic action, all of that leads to a situation where you can sort of take the person from here to here in the space of a few days without risk. Nasolabial folds, when we see it in a light face, we can easily treat them with just the Juvederm Ultra Plus or a simple filler. And since these are hyalocross fillers, and I'm sort of demonstrating results that we used to get earlier in life when we had only the very initial fillers in the Indian market. and to a situation now where you have all the fillers and the threads that you almost have in the US. But even at that stage, you could sort of do this very, very easily. It's a 5-minute job, and you can remove the nasolabial folds, and that changes the perception of aging. However, when you see certain people with very heavy faces, please note here that there is not only a valley in the nasolabial area, but there is also a mountain in the nasolabial area. So what is happening is that all the tissues are moving downwards and medially. And if you need to create anti-aging, you actually need the tissues to go upwards and laterally. And for you to do that, you'll have to sort of raise the prongs of the face and use a heavier filler in the lateral portion of the face, thereby causing the face to move laterally and thereby causing the mountain to move upwards, which is in the zygomatic and the maxillary areas. And by doing that, then you can use a mild filler in this particular part. So the combination of the heavier filler, higher G' filler with the lower G' filler can sort of create the results that you're looking at. Facial thread lift is something that we do very regularly. And this is how facial thread lift gets done. And you can sort of So how the facial threads end up doing, what they end up doing is they are made up of a material like PDO or PCLA. And these are threads which will get absorbed over a period of 12 to 18 months. They are like a rose stem because they have thorns all the way around. And these cogs or thorns are the ones which engage the facial fat and sort of pull it up. This procedure is being done just under a local anesthetic, which is prilocaine jelly. And you can then snip the threads very close to the skin so that you can then cause the fat pads to go back to where they came from and sort of raise the face. In a heavy face like this, using the threads is important because by using the threads, you can sort of lift the mountain to where it came from. I'd appreciate it if Mr. Lakhani could just extend my timer for the next 12 minutes, which is for my next presentation as well. I'll just continue from here.